on? I had mine on the other day. You weren't here though.
And what do you got? You got stripes?
I got boring stripes.
Right.
Stripes
You know,
socks.
on
These are
anybody
monkeys in
else,
power
That would
suits.
freak us out, but. are you-
Insert joke here.
Speaker, before you start, we have availability with the speaker on Tuesday, the 17th, the afternoon, 30-minute session. So if anybody wants to sign up, I'm just going to send this around. So
Okay.
Good and oh so smart.
You have to bring
You can
Rob.
be in town.
And people really like.
Check my
people
schedule. I hope you
Is
guys
this-
are taking my
is this
schedule.
Tuesday after the,
Check the flight.
this is Tuesday after the session then?
Can you tell me?
yeah, the Tuesday after the session.
Are we gonna
Oh,
go
the
through
Tuesday
all that?
after the session.
I think everybody.
Like, who cares then?
What?
Who cares after the
Um,
session?
Are we
Maybe a
gonna
wrap
be
up or
talking
something.
about this?
We could possibly
Well,
do that day.
I've actually relegated myself to this one of these topics for the rest of my life.
You said for 2 more years.
All right, let's get
Okay,
started.
we ready to go?
Hey, let's do it.
Mr. Speaker, how do you feel about the Democrats' stunts the last couple of days?
You know what, now that we had, I guess in hindsight, you look at what happened on the floor today. You had a substitute for the Healthy Utah proposal. You had Representative Dunnigan's bill presented. You had a substitute that was adopted from that Representative Dunnigan supported and that we supported. You look at that kind of dialogue that was able to occur today, and you compare that with last night's attempt to take a bill that didn't pass committee, and we have a rule that says that bills that fail out of the House could not be passed, could not be voted on for final passage. I don't know. We've heard a lot of comments about the process and everything else, and it struck me as selective outrage to ask the body to consider a bill that had failed out of committee. So I wasn't. I thought it put some of our colleagues in a tough place that did, and you saw in their votes today, support an alternative plan, the Healthy Utah plan, but on a vote of process, did not support the efforts last night, and those votes could be misconstrued, and I think that's unfair to those lawmakers that found themselves in that situation.
I think that was the vote that what we saw today was the vote we would have likely seen if it had been, if the original Healthy Utah plan.
You mean last night's or today's?
Today's.
Today's, I think that was a yes. The answer is yes.
So right around 22?
You're talking though, the selective outrage is aimed at last night's attempt to lift a bill that had failed in committee to a floor vote. You don't feel that way about the procedure today to substitute because you actually helped.
Well, we researched that. I had actually
Consider
thought, because the title had changed, as I've been on the dais and we've seen a title change to a bill, we twice this year and in times in the past, we have, under suspension of the rules, considered that bill read for the first, second, and third time and for final passage. She'll have to talk to Ledge Research on what the differences are, but I had originally thought that you would need a suspension of the rules to hear that substitute because the title of the bill had changed. But we had a little bit of a, kind of a pause there as we got that right, but it turned out that it did not require a suspension of the rules. So, that allowed, in hindsight, actually, without having process seep into the conversation, you could have a straight up vote. And that's what you saw.
And
Do you think-
it was 18 to.
Now, it was 52 no's
Mhm.
and 22 yeses,
Oh, 50.
with one.
Well, that was
One
on
missing.
substitute 4, right?
Well, if it's to the point you're saying about an up or down vote on Healthy Utah, that substitute was that bill. And because there wasn't a need to suspend the rules, you did have a dialogue or debate and consideration of that bill, and process did not get into that debate like you heard last night.
But I did notice some lawmakers vote no today who have spoken publicly in favor of Healthy Utah. So perhaps there was some procedural issue with them in that as well.
You'd have to ask them, but what I think one of the things that you saw is that with the substitute bill that was adopted, that Representative Dunnigan had worked with Representative Redd on, I think that bill I think that bill as it's left the House is something that not only the House, but Utahns can be proud of. I think this works in what we consider safe harbors in terms of sustainability. We do not believe that we will treat Utahns like yo-yos through this program. We're in the House for the long haul, and we believe and we know that we are leaving this this situation better than we found it. This coverage gap, or those that don't have health care coverage, there are answers and a solution to that. And I'm proud of it. I'm proud of the work that Representative Dunnigan's done. I mean, he has worked he's never stopped. We've said this over and over. He's never stopped working on this bill. And I think that, again, with the substitution you saw, I think people understand. I think there was an understanding that we need to get behind a policy that can get the votes and the support to move forward. And that's what Representative Dunnigan's bill represents.
Any concerns the Senate's going to try to substitute and put their own bill in?
Sure, but politics is the art of the possible. You look at that committee vote, you look at the vote on the floor on the substitute. I don't know what's possible about anything but what we're talking about. You have the Senate. The Senate initial proposal was what some called frail Utah. That is not the bill that the House passed today. You have on the other side healthy Utah, and I think you see what you see in public policy, and when you're committed to getting something right and not letting the perfect become the enemy of good, you saw a gravitational pull to something that we can get support for and move forward. I think that is what this process has always been about, and that is what you saw today.
Is the process over, though? I mean, do you expect to have something sent back from the Senate that it has at least portions of Healthy Utah incorporated in it, and what happens then?
I would hope that people would observe what we've done, where the debate has gone, what ideas were out there, where I think the House has moved in terms of its support, broader support for when we talk about Medicaid and addressing the coverage gap. I hope people understand where the political lies. And if people are committed to getting something done, I think that what's happened today on the House floor informs and helps drive us to passing something good. If we want to ignore what's been going on, then we'll have to see what happens.
Representative Dunnigan, just to clarify some numbers with Utah Cares. So we have about 22,000 that would expand into Medicaid as we know it today, and about 60,000 that would be in the program. So that's about 38,000 on PCN. Does that 38,000 include the 18,000 or so that are already on PCN today? Or is it in addition?
Does, because we have about 18 in PCN today, but it's caps. We have people that want to apply, want to enroll in PCN, but they can't. So this removes the cap and completely fills in the coverage gap. But it doesn't stop there. Between 100 and 138, today, people can go to the federal exchange and get a platinum plan and pay 2% of their income, which is very similar to the coverage and the cost that they would have under Healthy Utah. So the mechanism that we're using covers from 0% of poverty all the way to 138%. For those last 50,000 or 40,000 Utahns that go up from the 60 to 120, whatever, they get coverage on the federal exchange and the federal government pays 100%.
So we're looking at maybe another 20,000 on PCN
Yes,
above what's already on it today.
that's correct.
Okay.
And with what we've done today, even the people that are currently on PCN would have a little bit better benefit because the third substitute today added to the list of primary care physicians that can treat PCN patients. We've added psychiatrists and psychiatric nurses. And so we're extending the reach of what we can help people with.
Can I say too, I've been thinking this through, as you pointed out that some that had supported Healthy Utah, you saw voting for the plan that the House, that we voted off the floor. You need to know that there were many colleagues that thought a wait and see approach was the best approach and gave us more certainty next year. There was a migration from that group as well to this plan. So again, I want to highlight that you had a very varying opinions, but where you're spotting some of those that have come to this plan and asked yourself why. There are also those that thought wait and see for a year and thinking that was the better course as we began this discussion, have also come from that position to the bill that Representative Dunnigan passed today.
Representative Dunnigan, are you interested in continuing negotiations in maybe trying to blend these bills with Senator Shizawa's proposal?
I'm interested in covering Utahns and to help facilitate that, or to the point that we can do that and work with the Senate. I'm certainly interested in doing that. I think I've heard fairly loudly from my colleagues on the House floor their parameters and about how far they're willing to go. They want to do something, but they want it to be sustainable and have some certainty on the budget aspect of it. But I've always been and continue to be willing to work with others.
You made a point several times today to say that this wasn't anything to do with Obamacare, anything to do with Medicaid expansion, but you wouldn't be able to cover those 22,000 people without the Medicaid expansion, correct?
About 100% of poverty?
No, the ones below 100% of poverty that you're adding onto this
No,
plan.
okay, thank you for asking that question. This is the fact. Obamacare ends tomorrow would not impact those people. That they would be a waiver on our existing 1115 program from the federal government.
The 70.
PCN, the 70/30. Now, in our current Medicaid program, we cover adults to 50% of poverty. All this does is raise that up to 65%. That's our current Medicaid 730. It is correct to say that has nothing to do with Obamacare.
It will require a waiver, right?
That has nothing to do with Obamacare.
Right, but I'm just,
PCN is a waiver. We've applied and we have
But it's the Medicaid expansion portion
What's
of
that?
Health to Utah.
Health to Utah requires.
Well,
a
they can't, the Health and Human Services can't have it both ways. I've been on the conference calls with them. If it is ACA, well, there's a 90-10 match for ACA. And we would ask to be within the coverage gap that ACA doesn't cover. They say that no, that is not ACA. That is not the plan. If you're asking for waivers within the 0 to 100% and you're not willing to go above 100%, then you are in fact asking for waivers under traditional Medicaid. That's what they've told us. We're not creating those new parameters. That's what they've told us to say, that we will not cover to the funding match or the federal match that we will under ACA. So they've said this is not ACA. This is a traditional Medicaid waiver that you're requesting. And there's good conversations to have in there. This, again, what you see in that bill is also the product of those conference calls and what we've done to get information from them to know how to put this bill together.
But it's expansion in the sense that you're able to cover a different portion of the low-income population.
It's an
correct?
extension. It is an extension of our existing Medicaid program. It is not an expansion under the Affordable Care Act. It just absolutely is
But
not.
why are these people not getting Medicaid now?
Because we elected as a state years ago not to cover that population. We could have. Other states do already under traditional Medicaid. Some of the states do. We elected, this is before my time, not to cover adults if they didn't have children within that, what has now become the coverage gap. Remember, the coverage gap did not exist until just recently.
And we've also spoken about the fact that we have decided as a legislature in good years to expand Medicaid for dental and vision. And then as shortfalls have occurred, we've pulled that back. And so we've watched the extension of benefits and pulling those back, and that has informed this process as well. Speaking for myself, going through that cycle of providing, pulling away, I left that experience thinking you better be serious about what you're about to do and you better be in for the long haul. But I don't find that to be an acceptable way to do it.
How do you reconcile the difference between Dan Jones' numbers that are tending towards Healthy Utah and the fact that you're describing political will being with?
It's a great question. I need someone to pose the question to me that I would receive over the phone that would describe the complexity and the challenges of this issue in that one question. I think that I think it's very difficult, and I think that when you look at polls certainly inform this process, and it's important. We send out surveys to constituents because we need to know, but it's more meaningful to me in a town hall meeting, or as we walk through some of the challenges or some of the worries we have as we look at this and that kind of feedback. We think we're talking about more information. I worry about polls on something that's this complicated to really drive the policy decisions based on those poll numbers by themselves.
Perhaps I can give you an example. I've had a number of emails from people that said, I currently have coverage through the federal exchange and I have to pay a certain percent of my income. I don't want to pay that much, or I can't afford that. I need Healthy Utah, so I don't have to pay that. If they were on Healthy Utah, they're going to have to pay an almost identical amount. That doesn't change. You pay between 100 and 138% of poverty. On the federal exchange, you pay 2% of your income. Healthy Utah is going to be almost the same cost. This is very complicated. It's very technical. A lot of people don't understand what it is and what it isn't. They say, why don't you want to cover children in the coverage gap? Health Utah does not cover any children in the coverage gap. They are already eligible for Medicaid, so it's not going to change that.
We talked already about some representatives noting that, I'd rather Healthy Utah, but this is better than nothing. Is that a strategy you can take to the Senate and sell this plan? You think that it's better to do this than to do nothing?
Well, I think we hope our colleagues in the Senate will give this careful consideration. I think this is what it's come down to. Do we want to accomplish something this session? Personally, I do. And I have a temperature of how far my colleagues are willing to go, and I think we're at about that point. So I hope that we can link arms with the Senate and with the governor and actually accomplish something, recognizing there's no deadline to expand and to go after that 90% dollars at any point in the future if we get more flexibility or if it looks like it's going to work.
Can you talk about what's left this session? You started with a lot of big issues, a lot of heavy lifts, as I think you said your first day up there. Got this through today. It remains to be seen what the Senate does. Left to do this Senate and or to do this session, what won't get done?
Well, the anti-discrimination and religious liberties bill will be on its way, we expect, from the Senate. We think that's historic in its support, its content, and its support. So that's one. I think transportation funding is a critical issue that has received a lot of deliberation, and remains to be seen how we address that at the end of the day. There's still good conversations going on. Representative Anderson's bill is well on its way. We have a Senate bill that's in, I think it's in our possession.
Changing, as a matter of fact. It looks like it was amended to go up to 6 cents.
Yeah, so we don't have it yet, I guess. 'Cause they're
So
sending
it doesn't
so.
sound like there is agreement between House and
No,
Senate.
but
on
there's
how to
still
go
time, but
about
if you ask
this.
about what heavy lifts are out there,
Yeah.
transportation's certainly one.
And then transportation, religious liberty, anti-discrimination.
Our budget, we've made some great strides. We just left a executive appropriations committee meeting and approved our budget numbers. There's still more to come. Some loose ends that you address always in the bill of bills, but we have most of that budget now agreed upon.
From last night, right?
From last night, from caucus deliberation, as well as the executive appropriations committee meeting today that we had at noon.
No changes in the EAC, right, though? It was the caucus position from the Senate and House.
For the most part, yeah.
Has this process with Healthy Utah worn you down physically?
Am I unhealthy from Healthy Utah? I think I am, actually. Yeah, I said for a while, we've got to get through this issue because we have these big issues coming up. I've resigned myself to this issue till the last second of this session. That will be probably, it's not going to go away. It might not go away after the session for all I know. I don't know. But no, yeah, it's a generational decision. So to say that we should have decided and moved on long ago, in hindsight, I think it's getting the kind of attention that a generational decision merits. That said, it is. It's been. I'll tell you, it's not how I thought this session would go in terms of the time spent.
One of the bills you're not going to be considering this year, and I'm going to ask about this because it has nothing to do with any of this stuff.
Thank you, Ben.
You're welcome.
Why don't you sit over? Come on.
My gift to you.
Thank you.
One of the bills that you're not considering was introduced very early on. There was a study on it, a lot of money spent on it, daylight saving time.
Yes. Actually,
Why-
I'm not laughing. Wherever the cameras are, I'm not laughing at that. It's a serious issue with a lot of
And
constituents.
this weekend, guess what? You get to spring forward. So why didn't you guys consider it?
I think as soon as we lose that hour of sleep, Ben, I think we're all going to take that bill much more seriously. I think we're all going to feel sleep deprived when we show up. This is one of those interesting areas of public policy that maybe some would think is not as urgent or generational in terms of our decision making, but all of us are receiving emails. People do have an opinion about daylight savings. I don't know where that goes. I honestly don't. All kidding aside, I think it becomes hard when you get yourself out of a time zone. If this world is flat, if technology is making us closer and closer together, those time zones can start to interrupt that. And if you have a state that's not kind of in the mountain time zone, there's been a lot of discussion about how that changes things or what the impact of that would be or the unintended consequences. And so it's actually probably to make that change has more impact than maybe people imagine, but there certainly has been a lot of discussion about it and even study, I think, over the interim paid to that issue. That one's going to be one of those organic movements. That's going to have to come and move up. It's not something that we've spent a lot of time as a leadership team deliberating over, but I wouldn't rule it out either. You never know.
But the bill never made it out of rules.
There was
Representative
a Senate bill.
Right, the
to
Senate
change
bill
to central time.
required federal approval, and that, they killed that really
It
quickly.
does. So but that's inherent with the policy. Most I hear from people is we hate changing our clocks twice a year. That's, it's inconvenient.
It's a first world problem, but yes.
Yeah, we don't like to do that. Fortunately, many of our clocks are now changing themselves for us, but I know there's a disruption in time. And I think that speaker's right. There are people on both sides of that. The ones that want more to retain the evening hours in the summer when you have daylight and you can do all your recreational activities, and the people that just don't want to change their clocks twice a year.
Okay, one more question?
I have a question about PCN, going back to that thing, but if someone is diagnosed with cancer, as I understand it, their diagnosis is covered, but then is their treatment covered by PCN?
So it depends what type of cancer, but thank you for asking that. If a person has breast cancer or cervical cancer, and they make below 250% of the federal poverty level, which is actually way above what we're talking about, so certainly cover all the people in the coverage gap, that's a category that is covered under Medicaid. So as long as your income's below 250% of poverty for breast cancer, cervical cancer, that's covered even if they have PCN.
How about men and cancers?
No, if they have testicular cancer or some other type of cancer, they could see a primary care physician. Specialty care is not covered. Now for the 22,000 Utahns that are not on PCN, they would have full treatment for that. And so Utah Care certainly addressed that in a complete way.
Okay, thank you guys.
Thank you.
Thanks, guys.
Thanks a lot.